أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الصلاة والسلام على رسول الكريم أما بعد. My apologies, I was staring at you for a few seconds. I actually was waiting for Abdul Bhai, and something happened, and he completely disappeared. And yeah, so you can imagine shock. So I'm just thinking, where is he gone? Okay, Alhamdulillah. We have a great show today, and we have some great guests, Alhamdulillah. So every week we've been discussing different topics and titles, issues that are affecting the community. This week we felt we had no choice uh, but to discuss, tier four lockdown. We're hearing a lot about tier four lockdown and the community's response. All of us know someone, this last few weeks, all of us, I think, we know someone who has had COVID 19 or they're COVID 19 positive. Now, from Eating Care, we are dealing with unprecedented number of people that we're providing burial support to at the same time offering burial support. Only today we're coming back from a burial in Birmingham. So what needs to happen is we are going to have a discussion because the community um, are concerned about this. When we were doing our food drops last week, we met a number of elderly people who were having their immunization, and it was good to hear that they were, that the priority list, they were elderly and they're vulnerable. So today, Alhamdulillah, as soon as Abjobai is able to join us, inshallah. Yeah. Abjobai, are you back?
Yes, I'm back. Assalamu alaikum.
Alaikum salam. My
Good, good.
apologies. I introduced the topic. I was waiting for you to come back.
No,
And,
no, that's good. That's good. I was actually sharing the link to everyone. Obviously, we were on a countdown, but you did fantastic. Well done.
oh,
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الصلاة والسلام على رسول الله السلام عليكم ورحمة الله وبركاته to all those who've actually taken the time out to be with us today. Obviously, we are all going through a bit of difficulty, and inshallah, being online and being consistent is very important for us. So at least from 13 Rivers Trust, we are doing our best to engage with the community. Inshallah, we want you to kind of contribute today because today is more about yourself and how you are actually taking on this challenge. Obviously, it's a third time round. We're actually moving into tier four on Sunday, Boxing Day, basically. It's been announced, and obviously everyone's been waiting for this. It was actually coming. We knew it was coming, but we all thought basically we'd have a lovely Christmas, enjoy our time with our families, and but obviously that's not happening no more. So what is happening now? 6 million more people will be introduced to tier four from midday Sunday, midnight Sunday. And what that really means, what does that mean to you? I mean, obviously, some people are fed up. They're totally fed up. I know from the feedback I'm getting from people are just fed up with this lockdown. This tier four lockdown. Is that going to have more burden? I mean, already people have been kind of like traumatized with the couple of lockdowns that we've had, or the partial lockdown, or however you want to say it. A lot of people are still confused. What does the tier four lockdown really mean for us? If the vaccination is already here, why do we need it? So, there's loads of questions people may have. On a general note, what we want to do is we want to get your feedback. So it's easy. All you got to do is call us. And also, you got to share the link. So if you're watching us live on Facebook on 13 Rivers Trust, please take the link, share it so that other people can watch us. They can also contribute and message us. We will actually read some of the messages out, inshallah. And also, we will take your calls as well, and we'll give calls a priority. So basically, very generic. It's about the Tier 4, what's it mean? How have you been doing? How have you been coping with your families? You know, I know you're not poor, but when you're sick with COVID, you know, are you able to look after your family members? How are you supporting each other? Yeah, let's have a broader discussion on this. With me today, I've got Sister Samantha Angela Thompson. She's here. She's a social worker as well, so she will get some of her input. I just want to welcome her to Eden Care as well, and 13 Rivers Trust. Inshallah, she's going to help us with some of the other programs and activities as well. So it's good to have you, sister. Inshallah, how are you today? And Jazakallah for actually taking the time out to be with us.
Alhamdulillah, I'm fine. Great to be here. Hoping I can benefit, you know, the organization and help a lot of people. Good. It's a good topic today because the lockdown is driving people crazy, to be honest. And in terms of a social care or social worker response, it's been extremely negative. So it'll be interesting to hear what people have to say.
No, most definitely, and we need to encourage people. So I want to give everyone an opportunity to kind of like share our links and kind of get on board, because obviously this lockdown is going to be a crucial one, because this is a lockdown while we have the vaccination being rolled out. Obviously, there's a slow process in that, and I understand the technicalities. You know, it has to get a certain temperature, and our infrastructure, our care homes are not adequate in taking large supplies. There's a lot of technical issue. We as a Joe public, we don't understand all that, nor are we interested in that as well. What we are interested in, we want a solution. We basically want a solution so that we can end this style of lifestyle, so that we can get back to normality, which if there is any normality in that, yeah. Just to let everyone know, so those of us who live in Sussex, Oxfordshire, Suffolk, Norfolk, Cambridgeshire, parts of Essex, already in Tier 4, Waverley in Surrey, Hampshire, including Portsmouth and Southampton, and excluding New Forest, will come into the new like Tier 4 restrictions. Inshallah, hopefully through the discussion, we will see what that really means. And obviously, some of the other northern countries are still at the Tier 3. So there could be a chance that some of those Tier 3s will be moving up. So basically what we're seeing is the virus, you know, kind of like taking extreme hold of spreading. And it was interesting, a couple of days ago, we heard that there was a mutation of the virus. And I've got a bit of a smile in my face because I've been watching all these films, you know, like where these virus films many years ago. And you know what? I'm getting déjà vu. I'm getting like all these things are in the movie. And we're just actually in the movie now itself, and you know, and we can't get control of things, and you know, we're not really prepared for this. The government's actually failed us on numerous areas and that. So I'm not really sure, are we still on herd immunity, or now the solution is the vaccination, or why is it that we still have to wait another 6 months for it to be rolled out to the wider population, or is there still some conspiracy theory out there that basically they still need that time, so they need to roll it out, and also the government doesn't want to be sued, so the blame has to be on the public all the time, yeah? So, you know, we're interacting with people, we're breaking the rules, so we can't actually blame the government for anything, and we can't even sue them. So anyway, I mean, it's not my knowledge field. I'm not a legal expert nor a medical expert. I'm not sure any of us are here. We're just ordinary people concerned about our communities, and if we can give a platform where people can address their views, we'll respect everyone's views, inshallah. You know, we're going to try and make it, you know, accurate and factual as much as possible. If you're critical, that's even fine, because obviously I believe that the more critical we are, the more firm we're going to be with our decisions and our opinions. Yeah. So when it comes to the vaccination, are you one of those people who are willingly going to be, you know, allowing your elderly people to take the vaccination, or have you got concerns, or do you think we still need to wait a little bit for the vaccination to be rolled out, so that other people, it can be tested on other people, and then when it looks like everything is okay and people are not reacting to it, you know, you'll take it 6 months later or 9 months later down the line. And before the COVID period started off, I was always aware that this COVID situation is going to take us, you know, up to about 18 months. Okay. And all the whole planning has been about when can we get the vaccination ready. So everything else we've done as a government, you know, is it just like kind of passing the time? So yeah, so let's quickly go to Abu Bay. I know he's also a social worker, and he receives a lot of these kind of difficult cases and that. But we don't want to go into the difficult cases. But generally, this tier 4 lockdown, Abu Bay, do you really believe that people are going to adhere to the rules and regulation?
Well, I think a lot of people, because of finance, economics, they have to go out and work. And the support, these are the frontline key workers. We're talking about a lot of Muslims work at the front line. They need to, they work in what do you call it? Taxi service. They work in front line. I was only in Iceland a few days ago, and it was a Muslim brother. He was saying we have to come in and work. We have to serve the nation food and what they need. So they really don't have a lot of choice, and that's why we're finding. That's one of the reasons why we're finding why so many BME stroke Muslim communities who are being impacted by COVID-19. I think we're also seeing because the last 2 weeks we're seeing a surge in the numbers of people getting COVID-19. Only 2 days ago, it was up to 30 to 40,000 people in one single day. So it is very worrying. What we're finding is the whole family are being impacted, from the children to the adults, and we are trying to with our befriending and advocacy support, we're providing a lot of telephone support and also warm food that we provide twice a week. We're finding that families are only today a family they all got COVID-19 and they were down to 2 nappies. So we quickly had to respond and provide that to them as soon as possible, because normally they would turn to their family members, but if their family members has COVID, they're worried. And so what we are doing is I'm expecting the next few weeks is going to be tough for the community.
Sister Samantha, what do you expect from this tier 4 lockdown now?
Well, I'm expecting anyone who didn't take the lockdown serious to start taking it more seriously now, because I know it's getting on everyone's nerves, having to kind of, stay in your homes, social distancing and everything. But I personally feel that the tier 4 needs to happen now that we know that the virus is, spreading faster. There's a new variant of it. So I do think steps need to be taken. You can never please people, to be honest. So some people are just completely fed up with the lockdown, and other people are abiding by the rules and they see the benefit in it. I mean, can you imagine if there were no tiers and there were no social distancing? If we can get 42,000 deaths in one day, if nobody's adhering to the rules, it's going to be a lot higher. So I personally feel the lockdown is necessary. Yes, it is irritating. It's hard. It's even more harder for people who were struggling before COVID-19. So people who had financial difficulties, there's been a surge in lots of, social care issues, like, feeding the children. The children are not at school sometimes. So that has a knock-on effect in terms of finances. But there's been a lot of deaths and a lot of sadness. So I think we're just going to have to kind of play by the rules, and just play. Each individual human being, not just in the UK, around the world, has to play their part in order for us to kind of, get this under control.
I mean, generally, you expect people to be considerate, caring, and generous to others. But do you think we as a society, we've actually moved so far away? But because the importance is me, I think a lot of people are not really, they don't have the capacity or the coping mechanism to actually think in a way where if I make my sacrifices will actually help and benefit others. Because a lot of people are thinking, okay, well, I'm not in that risk category, and it's affecting my livelihood, it's affecting my way of life, it's affecting my communication, it's affecting my hobby, it's affecting my leisure. So if it's a me type of society, what else did we expect? I mean, like, did we expect that, like, we as a society, like totalitarian society, that we were just going to basically, whatever the government says, we're just going to follow them and just, but because if the government like said, yes, listen, lockdown, no going eating out, let's lock the schools down 5-6 months. Do you think we would have had the virus under control? Why was it that we had to have so many like opening up and then suddenly doing U-turns on that? Do you think already we're affected, and that's why we are so dependent now on the vaccination?
I mean, is that question to me?
Anyone? Other way.
I'll let Sister Samantha answer that one.
Yeah, I mean, we have mixed personalities and characters in the UK. So there's always going to be people who it's me. And I think initially, I think UK was one of the last countries to really start doing something, because when other countries were locking down and taking it serious, we were still like, in the party mode. I can remember driving to my car and my neighbors having a party in the back, in the garden. So we were like happy mode. Even myself, I was like, but those people who were like not taking it serious, I think the amount of deaths we've had, and for many of us, myself included, when a death is close to home, I think you have to take it serious, and I think you have to kind of play your part and stop being selfish. I mean, do you have to get COVID-19 in order for you to kind of think about other people? It shouldn't be that way.
But Samantha, like, for example, the medical scientists and experts are saying, the COVID actually affects 1% of the population. There is going to be deaths because obviously there are people who are basically, like health-related conditions and that, and there are vulnerable people. It's 1%. The argument now, people are saying, look, that 1%, compared to all those other percentage who are now at risk of suicide, mental health, people losing their jobs, and that's having an impact on the whole families. So you've got from one major big crisis issue, more crisis issues being building up there. So you've got multiple problems that are creating. So it can be quite difficult for people because obviously depending on what perspective, which position they hold, they might say, I've heard people on mainstream radio say, look, it's only 1% of the population. Yeah, we've got to be now thinking about and obviously people are in the fields where they see people dying and passing care people's homes and projects like Eden Care. You're face to face with reality where you're actually receiving, all the information about death. But majority of people, they don't see that. They're not seeing how many people. They only see on the news like this amount of people have passed away or been affected. But I actually went down in one area where one of the testing center was, and I was kind of shocked. And guess what I saw? I saw queues of people waiting to get the test done. That proves to me the virus is at its kind of like speed, and it's actually, you can actually physically see it. So there's all these factors are key to this. Abu Bay, like,
can I just interject? Those 1% that people say. I'm going to give you some data from ONS website. Last year in the UK, about 500,000 people die a year. Yeah, approximately. That's averaging, sometimes more, sometimes less. Last year, 2019, 530,000 people died. 2020. So you have to work out from the year beginning, from April to end of March. So we still haven't come. We still have a quarter left. The projected death rate is 600,000. That's an increase of 70,000 people. Now, people can say that 1%, and that 1%, those people who say 1% It's the mindset that those people have had in the first place, because what they're talking about is economy. Now, what's happening now with this new version of COVID-19? What's happening now? All the European countries are restricting things, the flights. Yeah.
Yeah, I was going to say, listen, France already picked a fight on us, so they've actually stopped all our lorry drivers.
Right.
You know, even before Brexit.
Yeah. So what happened right at the beginning? Remember what happened in China? What happened? Countries like New Zealand and other countries they don't have this challenge as we are having. So what they did, they actually had a lockdown. They safeguarded the people. Whereas in the UK or America, what happened? There was non-stop people coming in through the Heathrow and other airports. And the reason to save the aviation industry, what's happened, the whole country has been impacted. It was a financial decision, unfortunately. And people just thought it would get blown over. And now we're seeing countries who are responsibly acting. And I think now this country also needs to responsibly act. And also the people need to responsibly act. This thing is real, bro, and sister. I'm going to tell you, it's affected me and my family. Yeah, and I've seen the after effects of it, and I've mentioned this about my 12-year-old boy, who after he recovered, he couldn't get over the coughing. He still was coughing for 2-3 months. Now,
Wow.
the other people are having other side effects that could have long-term effects. So what we need to do, if anybody's watching, we should be making our family members safe. But some people have to go out. I understand. You know,
I'm going to have to throw the sponge in there. Yeah, I think it's too late.
Sorry.
I personally think it's too late. We've actually passed it to make everyone safe. Obviously, we're doing our best at the moment. We still do, but I think because a lot of people are getting it now, a lot of people have got it, and I'm not even sure if the trace and track really works. You know, it's in everyone's head. Everyone's going to get it. You know, because obviously the government first started off with herd immunity, and then they done a U-turn on that. Yeah, so now we got the vaccination. So the only hope is that people seeing, oh, there's a vaccination out there. Let's, let the vulnerable people get it first, and let the key workers get it. You know, but obviously there's a process. They're not going to be able to get it straight away. They're going to have to. And my question is, why can they not get it straight away? Okay, there's logistical problems. Is it that we don't have the finance to buy it? Is it because we don't have stocking facility? Some of those are issues because obviously one of the vaccination needs to be at a certain temperature, and not all facilities can accommodate for that. So we're going to have to buy time. Now, buying time, people are still going to have to go shopping. Still, I mean, I've seen people going shopping and they're not able to maintain the social distance.
Abdul, Sister Rahela Sultana asks the question. Assalamu alaikum, brothers and sister. What are your thoughts on the vaccine? Some people talking about all these other things inside the vaccine and microchips and all of that stuff.
Okay. What was the question again, Abu Bay?
What are your thoughts on the vaccine?
Okay. Well, is she talking about the conspiracy theories?
Well, come on, there has to be some sort of element of truth in it. She's asking us what our thoughts are.
Okay, so let's go to the sister. Let's see what our sister.
Can I ask our sister Samantha? Have you had the vaccine? Because you're at the front line, aren't you?
I am at the front line, and I was just thinking that before the sister asked the question. No, I haven't had the vaccine. And what do I think of it? Fortunately and possibly unfortunately, I'm one of those human beings that I'm scared to get the vaccine right now. You know, vaccines normally take years and years, to develop. From what I found out, I'm not a medical professional, and they've had to develop this vaccine very, very quickly. And when you do have medical professionals going live and saying various things about the vaccines, it makes me I need more confidence. I need to have more peace of mind. So what I think about the vaccine is I'm not sure about it, to be honest. As a frontline worker, a human being, I just don't know yet. So if someone was to say to me right now, you can have the vaccine, I would probably say not yet. I think a few more million people need to have it first. And let me see what happens after effects. In all honesty,
it's just the honest gut feeling. I mean, it's good to be honest. I mean, because at the end of the day, people got to make their mind up. Yeah, because I think we're in a bit of an information war here as well. I mean, do you remember when the first declaration of the vaccination on the elderly lady was a big success?
Yeah.
It was a lot of celebration. I've got to say, that was really, really remarkable. And she's very brave, I've got to say to her, yeah. And there are a lot of people like that who would like to quit. There was one elderly lady, she called up one of the radio station and she said, look, I don't mind the vaccination, yeah. So even if that means people can learn if there is adverse reaction or whatever, she's willing to actually sacrifice herself in order to make a step forward in kind of like closer to the cure. Okay. And I think it's a valid gut feeling that you have. I mean, a lot of people are, because people do need to be persuaded, because information war is about a lot of confusion out there. There's a lot of conspiracy theories out there. And most of these conspiracy theories, people are well educated, they've got PhDs, and we, like local people and average people, what else do we know? And obviously the social media is a big platform where people kind of like share all these kind of things. And it does scare people, because I'll give you one example, yeah? Okay, so I've received one video clip of a nurse or some medical staff member taking the vaccination, it was injected into her. And then she's doing a press conference or something, and she's giving feedback positive, and then she's slowly started to faint, and she collapsed. Okay, now I don't know if that was
real.
Sorry?
Is this real? I mean,
yeah, it's real. Yeah, it's real. I don't know if it's video editing. I'm not an IT. I'm not a media person. I don't know if someone did some of those kind of like Hollywood or Bollywood style of like whatever, but it's very, very persuasive. Like seeing that was quite shocking and scary for me, because now they've used her and she's now started to say some positive stuff, and she's slowly and then she actually faints. Okay, but we've had, factually, we've had two medical staff members who took the vaccination who there was a reaction to that. Like there was they had a bit of a reaction to it as well. My question is why do we need to find out about these reactions? Why were these reactions dealt with in the assessment and development process? Yeah.
Okay, I've got an interesting question for you, Abdul.
Well, why me? I'm not the expert, yeah?
Yeah, no, but what it is, Rumel Akhtaruz, he says, brother and sister, we are in 2020. Coronavirus is not new to scientists. It's been there for 100 years. Also, it's a global pandemic. So they had data from many countries same time. It's safe, and considering how dangerous COVID is, it's personal choice. We should not spread conspiracy theories as it could harm the most vulnerable. Rumel, if you want to call us, we're happy to take your call, inshallah.
Look, like in court of law, you have to have no doubt when you want to convict someone. The evidence has to be sound, it has to be accurate, factual, it has to be there. Now, me personally, I don't think there is harm in people being critical on the facts, highlighting areas of concern, and people do have concerns. People raise questions, and I know the government is doing its best to kind of like provide the answer. They're not doing a very good job of it, but they're doing their best. The medical professionals are also pulling their hair out after that two incidents, because they just realized there's a big gap there. Now that gap should have been dealt with beforehand. Now people are going to raise this kind of question. Now, if you haven't got a tight-lit kind of a vaccination that is not going to be harmful to people, people will take it. There's no problem. There needs to be no doubt. If you're saying that you can actually produce a vaccination within this short period of time, and it's safe to do so, and it's gone through all the bodies and that, and it's been tested, that's fine. Then why are we seeing some reaction? And why now, after that incident, we had a list of recommendation that people with allergic reactions and that you shouldn't be taking it. Why didn't they know that beforehand? I mean, it's a legitimate. It's not conspiracy. It's just why they didn't do it.
Can I just say I was doing food drops on Thursday, and we were dropping them to we provide warm food to about 300 people a week, and last Thursday I did that, and quite a few people were actually elderly, very elderly, and they had appointments. Then you had to go and have it's a 2 appointment basis. So you have the vaccination is through an injection, and basically, and the people were happy to go. But I think there's a vast majority. What I was going to say, it would have given us a lot of confidence had Boris Johnson and the cabinet, these are people in leadership. Had they shown it with all the world press there, people, I think, would have instilled some confidence, because people are worried, something new.
In America, the leadership over there, they're actually taking it first. Yes, all the political leaders, the president.
Well, Sadiq Khan tried it. Sadiq Khan tried it.
Yeah, what happened to that one? Where did Okay, all right. Listen, we've got a caller here, right? So we do have to go to our callers, inshallah.
Is it Rumel? Rumel, I was just giving you the
number. Let's see who the caller is. Assalamu alaikum, caller.
Welcome, brother. This is Rumel, yeah.
Oh, yeah, brother Rumel. Okay, tell us. Listen, I'm only trying to be a little bit critical because, I just want a bit of... I'm not a doctor or a medical person, nor a conspiracy person. I do believe people should take it. But yeah, enlighten us, please.
Okay, so thank you. I mean, I'm really delighted to see that kind of program, actually. That's very burning issues at the moment. And I personally, I'm a doctor, I'm a GP, and I'm getting a lot of calls from my relatives and friends and family about there are a lot of questions around this vaccine. Now,
okay, brother Ramil, before you go here, mashallah, what's your full
name?
Rubel. Yeah. Let me write it.
Yeah.
Ruhel.
Rumel.
Okay.
Zaman Rumel, yeah.
Rumel, okay. Rumel, what, do you have 1 hour in your hands?
I can go, inshallah. Yeah.
Oh, okay. No, I'm only joking here, but you see, people want to know. So, it's really good to have someone from the medical background, because at least you can give that perspective as well. Yeah, so I'm going to leave it to you. Tell us, and then obviously we'll raise some questions as well.
Inshallah. So, I mean, as I said, I'm not an expert or I'm not like a virologist. I do have some general knowledge, and of course, like any other vaccines, this particular vaccine will have some side effects. But what I'm hearing is a lot of question which doesn't have any legitimate sort of background. For example, that one is a lot of people saying that how come this vaccine came within 1 year? I don't see a logic behind it, because if you can see, this virus is not new. This strain is new, but coronavirus started from 1920, where it was like on the animal, there are a lot of diseases in the animal. So the scientists are well aware of that virus. In human, 1960, 2003, the SARS, 2012, MARS, Middle East respiratory disease. That particular same virus, by the way. But this strain is more deadly. It comes out like a pandemic. So scientists already know a lot of things about this particular virus. And it's probably one of the unique pandemic where almost all the countries in the world are facing at the same time. So they do have loads of data. Millions and millions of people had gone through that virus. So they're sharing all the information, Europe, America, Australia, a lot of other countries. So they do have some advantage here. And of course, they are working so hard. I've seen one scientist from, I think, Oxford. Soon after the vaccine came, she was in tears. She said that we were working like day and night. I mean, we haven't taken enough break even. So that probably that question shouldn't be, a reason why people shouldn't be taking vaccine. The other common thing people are saying that this virus is not deadly. It's 99% people getting better. That again is the wrong information. According to John Hopkins, I made a video in my personal Facebook, and I spoke in Bengali basically, because a lot of rumors are going around in our community, and we are very I must say that we are very unfortunate, because since the pandemic, most of the Southeast Asian Bengalis are number one, and then Pakistani. I think Indians are like as close to as white British. So there has to be something going around in this our community. So John Hopkins report. Yesterday, I've collected 3.3% people died in UK. So that's not 99%. That's 96.7%. So 3% is a lot of people. 70,000 people died. So that's a deadly virus. And brother already mentioned, I think, your son, 12 years old, isn't it? He also had,
Yes.
like, even they recovering from COVID, people do have long COVID symptoms. And a lot of hospitals now started doing sort of COVID clinic, because those people are recovering from COVID infection. They're
That's
not
right.
really getting their lung function normal. A lot of people having breathing problem, a lot of other side effects. So bear in mind, those people getting better, they're not 100% in, in their, where before the COVID they were. So that thing is not right. Then other thing, like brother said, the cheap, and somebody saying there's a side effect. I mean, side effect is very mild. Like every year we do get flu vaccine. Nobody questioned that. Every year we do in a surgery, lots of people doing the flu vaccine. The exactly same kind of side effect. You might have a bit of soreness in your arm. Some people will feel flu-like symptoms, fever. Within 3-4 days, within a week, they're normal. So that's so far. We already probably more than 500,000 in UK vaccinated, and we haven't had any severe significant side effect other than few allergy, of course. And allergy, anyone can have allergy. Like, as you know, if you go to a doctor, they give you antibiotic, you might get allergy. So if you give 10,000 people vaccination, there will be like 5 or 10 people might get sensitivity. That doesn't mean there's a problem in the vaccine. Rather, their immune system, or every people's immune system are different, so they probably react different way. And another one common question people are saying about the Pfizer, sort of the business, maybe there's something going on there. I mean, I dispute that, because Pfizer's a lot of medication we prescribe before this vaccine. Well, nobody questioned that. I mean, common medication for lipid, cholesterol. We prescribe Lipitor, we prescribe Lyrica. These are painkiller. These are Pfizer companies produce this kind of popular medication. Nobody questioned that. So why they're questioning these companies just because they're producing vaccine? So I mean, there's so many things I can go on, but I'm just saying that we have to risk and assess. There's something we might not know, which is how long the immunity will last. So these are the questions we have to wait and see. You might find yourself in the future that you might need every year COVID vaccine, like a flu vaccine. We don't know. We have to wait. Yeah. Sorry.
Yeah. If you can hold on, let me bring Samantha in. Samantha, has that changed your opinion and made it stronger a little bit?
No, it hasn't. I feel like, with respect to the doctor, I think when he said, the vaccine coming within 1 year, and basically people shouldn't have an issue with that. The truth of the matter is, many people have an issue with that. It's more of an emotional issue. So they may not have any scientific evidence to say they're not going to take the vaccine. I think, the onslaught and the attack of COVID-19 has disrupted everyone, and people are scared. And now this vaccine, with all the conspiracy theories around it, which I'm not endorsing, people have a concern. So they can't just go ahead and take the vaccine because people say so. They need to feel like they need some convincing. They need to feel like more people are having it. And yes, there will be some side effects, but it's not easy for people, for us to just go and take it. Many of us. I mean, I'm a frontline worker, and I can't bring myself to just have that injection in my arm yet. I'm not saying I'm not going to have it, and I'm not endorsing conspiracy theories, but I think I don't underestimate the emotional concerns of people, around the world, because people are worried, and I think people just need more peace of mind. or possibly convincing that it's okay. Because we have been having vaccines all our lives. I remember having the BCG, I think it was called, and mumps and all these different ones. And yes, you do get some reaction, but this feels different. This COVID-19, where you're seeing so many deaths, and it's around the world, and people are scared. So it's not just a case of take it, it's fine. We have to take into consideration that people's emotional well-being needs convincing,
Sure.
Abu Wait, just before we go to our respected Dr. Wait, do you think, smashing the myths and also the conspiracy theories, there's been enough work being done? Do you think like the information has been made very clear to people? Why do we still have people still, very nervous about this?
Okay, I think with the advent of social media has made things complicated. And I'll give you an example. Do you remember when it first came out in Wuhan and we were seeing people on the streets dropping? Do you remember? Yeah, they were dropping because of COVID-19. And we never saw any of that. Number two, that they showed you on the news, and you was just thinking, what? Then 5G was being rolled out, and there was a whole lot of discussion while everybody's under lockdown. These people going around taking pictures of people or recording of people putting up 5G, and even now the news strand. And I understand what the doctor is saying. I think with all of the past and now the vaccine, I personally welcome the vaccine, and I think one of the main discussion should be is how does it get rolled out? The issue around safety, that's where I'll be honest, I don't trust the politicians. It should be, this whole response should be people who are experts on this field facing, if you know what I mean. Top doctors, top consultants, not Boris Johnson. Nobody trusts him.
Well, okay, well, let's go to the doctor. Doctor, surely the government, Boris is getting good advice from these medical experts. He's got these people on board who are actually giving, and that's why Boris is confused, because number one, he's not a medical person, so obviously it's not going to connect in his head. So he's being fed information from the medical team who are advising him, and surely we should have some confidence in that. Obviously he can get the economy wrong, he can get all the other things wrong, but on the medical and the scientific side of things, surely the experts are there, they know better than us. Well, doctor, what do you say?
Yeah, so with due respect to the sister, I totally appreciate what is her concern, and it is not a normal situation we are facing. As you previously said, we're in a war zone. We're not in a normal time. We have to understand we're not 2019, we're in 2020, where everybody probably, I have experienced so many deaths in my family even. So this is a different time. And yes, absolutely, that doesn't undermine the question around the safety and concern. And I'm sure the government has taken very, very vigorous steps. For example, any medication in the United Kingdom, before they go to a public, they go to MHRH, and this is an independent body, medical and health regulator. They are not government body. They do so many layers of vigorous sort of safety checking, and then it will come to the market, as we know. So I don't think that the government have any influence in it. And this vaccine has been widely accepted by USA, European countries. So it's not like UK only. Now, from sisters, what she was saying there, I appreciate it. A lot of people have concern, but people are dying. As you said, that people are dying around the world. 1.7 million people we have lost from all over the world, and this is a big thing. I appreciate that concern will be there. Even now, we get questions in my surgery. People do ask me question about MMR vaccine. MMR vaccine has been for many, many years, decades and decades. But still, some people are questioning it. You will have questions but we have to understand it's saving life. We're talking about life and death here. We're not talking about a rash. We're not talking about the vaccine reaction, a little bit flu symptom you might experience. Where we got concrete evidence of proof that 92% people have been saved from this vaccine. So, that is a big thing. And I've seen young people in ITU fighting for their life from this virus. And as opposed, we got a vaccine which might have some sensitivity for some people, yeah? And that number is, even if you give penicillin, common medication, amoxicillin, if we give 1,000 people, there will be 2 or 3 people who have reaction. And we have seen every day in out. So I haven't got the vaccine yet. I'm not fortunate yet. We're waiting for it, but I will take it because, this is a life-saving thing, I say.
No, Doctor, you bring forward compelling arguments, and that's what we really need in our community show.
Sure,
and
sure.
And obviously, Sister also, gives a gut feeling as well, because that is part and parcel of our experiences. Obviously, my question to you yourself again will be, obviously, proportionately, there are people with high risk. You've got the elderly people. You've got people with kind of like chronic situations, medical situations, which is going to affect them. Surely, someone might say, "Well, okay, well, let the people who deserve it the most, take the vaccination." And some people are saying, "Okay, well, we'll hold on for a little bit, another 6 months." Because by 6 months anyway, most of the vulnerable people will be in the process of having the vaccination. But the biggest question I want to say, obviously, the BME community is one of the highest when it comes to coronavirus. Do you think the BME community will be on the high priority list?
I think this is a very valid question you're raising. I mean, they should be. In my personal opinion, yes. But on the other hand, I think a lot of education, what you were doing here, that kind of thing need to be happen in a big scale, because our people, especially I can say for our community, Bengali community, Sylheti community, there are a lot of rumor around. Like, people still believe, the vaccine needle, there might be a chip. Can you imagine? Still thinking there's a chip will be implanted in their body and then government can control them. That kind of theories are around. And I get calls from our relatives and, that kind of question. So I think more than anything, we need education. We need loads of education, public awareness in our community, in Bengali, of course. There's lots of English talk about, not many Bengali people are talking around. So we need Bengali people going and telling other people, doing that kind of thing. Public awareness is more important here. Yes.
Can I interject?
Yes.
I'm sorry, Rubel Bhai, I have to interject here because it's no point just blaming the community. Why I am saying this is Eden Care is one of those organizations. It's probably the only BME Muslim organization that works with people with end of life who are terminally ill and then go on to provide burial support at the end. We buried over, since start of this pandemic, about 78 or so. We're providing food to people, over 300 on a weekly basis. I am going to say this to you: the NHS has been an abysmal failure. I can't use a stronger word than that to say, in terms of coordinating with the local masjids, with organizations like Eden Care, to educate the people, as you say, about this vaccination, how to take safety measures. That's point one. Point two, even with the vaccination, Abdul Bhai, what's the plan? What's the plan? How long is this going to? Are they going to vaccinate 1 million people a day or 500,000 people a day? Do you follow what I'm saying? Because the infrastructure is there. Yeah. What we're hearing, oh, this contract has been given to this person. We're talking about billions of pounds, and you're beginning to wonder what's going on. I just wanted to get that in there.
Yeah, no, okay. Yes, Rubel Bhai, you can respond, and I've obviously got my take on this as well. Rubel Bhai?
Yeah. Brother, the Munim Bhai, right? Yeah.
Abu Mumin, yes.
So, okay. I appreciate your point. I mean, yes, I can't deny that. I mean, there has to be, and I personally didn't see that much campaigning for our particular community, Bengali community. I think that there should be more and more, and there should be a lot of funding, especially in Tower Hamlets and the area, lot vulnerable people living there. I haven't seen that much. But again, they're working hard. I appreciate that. I mean, in our surgeries, we go, we are not sitting there. People are working hard, but yes, those people
Rumail
are
Bhai, they're not working hard
there,
consulting and working with the community. They might be working hard in their office and consulting within their few colleagues. You know, I've got Rahela. She says, to be honest, I'm still not convinced of the vaccine until we see the success rate. She mentions that on the message. So I'm just saying they're not engaging us. I'm just saying, Eden Care being the only BME organization in Tower Hamlets in East London, we're not being consulted. So why are they surprised, the NHS people and the government, that the community is responding this way? Because they're getting information from elsewhere, and they're not getting information through the NHS and other bodies.
Abu Wai, can I just politely pull it? I think what is happening here, the government and NHS have actually forgotten the strategy that they've utilized before with previous other kinds of campaigns, is community engagement. You know, community engagement is an essential tool that all big organizations must undertake in order to engage with their grassroots, with their communities. And I think on this particular major crisis, there has been a abysmal failure from government to, NHS locally, all over. When it comes to the BME community, they have not been consulting with the agencies and the shapers and makers in those communities. So, we're left with just medical doctors and politicians. No community leaders or activists have been kind of engaged with, openly, where we can actually work together in order to kind of get this information out. What really is needed is to bring all those organizations together that hold credible clout within the community, so that they can kind of steer some of these messages across. And, Abu Wai deals with a lot, I know, through the Eden Care Muslim Burial, and at times they've actually mentioned to me how they've actually neglected any kind of influence or, power within the BME organization. So, one of the fundamental questions, obviously it's not your area, but this is more of a, policymakers should bear in mind that, this is such a important message. That message needs to be communicated. And the best people are those who are actually working and leading within the community organization. Those community organizations need to be engaged. I mean, we can tell you that so many of these voluntary sector organizations are providing hot meals. They're actually reaching homes where people are actually suffering. They're not able to have hot food or so forth. And organizations are involved, but these organizations are responding positively. But when it comes to, decision making and feedback, are they being consulted? And that's a general question. It's not specifically for Rumail Bhai. But on a general, if I can move the discussion on, I know we're kind of like moving on time. Very quickly, Rumail Bhai, as a GP practitioner now, what kind of things can people do? There's loads of people who've got the virus now. Many people are, suffering at home. Are there things that they can take? I mean, obviously, people are saying just take paracetamol. Take. Are there any remedies or anything that will help them, from a GP perspective?
Actually, this virus, this is a self-limiting condition, basically. So our immune system actually fights back this virus. Yes, the message we are doing, or I work in out of our service 111, where we mostly consult with patients in the community from COVID, and our message is clear that we need to advise them. We advise them normally that symptomatic treatment. There's nothing more than that. And most of our patients getting better. Almost like how many percentage of people going to hospital? Very small. But because it's a big number of infection, that's why we see the surge into hospital admission. But before 3 months, it wasn't that bad. It was going as close to normal. So the suggestion is paracetamol is for pain. Of course, when they get COVID infection, common symptoms are aches and pains, headache, bit of sore throat, and then cough. Smell and taste also can people get lost their sense of smell and taste. So paracetamol is very good one. You can have your maximum dose, which is 2 to 4 times a day. Lots of rest, fluid, and that kind of thing. That if somebody feels blocked nose or things like that, they can get over-the-counter medication, antihistamine tablets, that sort of thing. But if they start having breathing problems, that's the time they need to consult their doctor, and they need to be assessed about for the complications.
If someone has
symptomatic treatment, yeah.
If someone has breathing problem, can they use the for sleep apnea? You get that machine. Can that be used?
Yeah, they can be used, but definitely they need to consult with their doctor, definitely, because they're sort of how bad the difficulty breathing. So when we talk about difficulty breathing, is a big thing. Whether they need an emergency ambulance coming to their door immediately. So that needs to be discussed with 111 immediately. If they have really bad difficulty breathing, they call 999 and need to be triaged and assess the level of severity of breathing issue, whether they need an immediate response within 10 minutes, somebody going to them, or is it somebody may have a difficulty breathing for years and years, little bit difficult. That's not a big concern. They're talking comfortably. They can be managed at home by supervision of their GP or 111 doctor. So that they need to consult. If anyone with a breathing problem, I say definitely take the phone and talk to someone. Don't wait at home. And they need to do that way. Yeah.
Well, Rubel Bhai, thank you very much. Unless anyone else from the guests got any questions for Rubel Bhai, it's a big pleasure to have someone from a medical background. Rubel Bhai, I look forward to maybe doing more individual shows with you as a GP.
Yeah.
That's really good.
And inshallah, I'm happy to talk to you guys. Yeah.
No, definitely. We need
nice program. I'm just calling you from my personal, not from an organization or anything. I just feel like I did do a talk in Bengali yesterday on Facebook because I got a lot of calls from my relatives. So why not I do a quick 10 minutes video and just talk about common thing. I'm not a virologist, as I say. I don't have training because we're not dealing with vaccine, as you know. I mean, if we've been asked to vaccinate people, we'll do it. We're not scientists, so we don't know much knowledge more than any other people. But I did some research, and these are the common thing. I don't think you need to be a doctor or scientist or anyone. You just need your computer and Google and see. You do have all the information. You go to Pfizer, you do have all their data. Yeah, all these things are public information. Anyone can access before they spread this message to other people and so forth. Yeah.
One last question before we kind of move on from yourself, Rubel Bhai. We're in tier 4 now, and do you think tier 4 will work for us, or do you think we need to do it? Are there any other things we can do in order to safeguard ourselves?
I think people are confused about tiers now, isn't it? I mean, a lot of people keep changing these things, and you have to be very much up to date with which tier is what. But I think it's all about personal sort of understanding. I mean, we need to follow the rules. Rules are there to protect us, but I think personally we have to take some sort of responsibility as well, because it is our health and we will be suffering. You can see all the data and everything. Once COVID attacks me personally, I'm the one who will be suffering. So I urge people to follow the rules personally. Even I think it might go more harder because the new strain coming. I mean, I've seen today. I hope you are aware of this. The South African strain, and very early days today they found, and so that I'm not sure upcoming days what's going to be, but I think they might go more harder. But we have to follow the rules and advice. We have to be strictly following the rules, and especially the holidays coming. We shouldn't be mixing, and we should be these few months actually. This upcoming few months, and I hope springtime it will be much less because weather will be changing. Anyway, winter pressure is there anyway. Every year, winter time we get overwhelmed, and on top of this year we have COVID. So this time is very crucial. We should follow the rules. I hope tier 4 should be enough. But yeah.
Can I just say to Rubel Bhai, if you could leave your number with our studio or message us on Facebook, we'll contact you, inshallah.
Inshallah.
Okay. Is there? I mean, I don't want to leave it like in the comment box. But
no.
Message you personally, or?
Yeah. Just you can message the organization personally and your name and number, and I'll pass it on to Abdul Bhai.
Yeah, Rubel Bhai, or you can go and message me on my Facebook privately. Yeah.
Inshallah. Okay. Munim Bhai, yeah.
Yep.
Abdul Bhai. Abdul or Abu Mumin?
Abdul Mumin. Yeah. Abdul Mia.
Abdul Mia. Okay, brother. Thank you very much.
Okay. Thank you for calling us as well. Yeah.
Thank you.
Jazakallah. Yeah. Okay. Well, Abu Bhai, it's really good to have a medical profession with us. We get that kind of perspective. We've kind of stormed over the time. We've gone 11 minutes over. We've not even shown any of our video clips. So wait, should we?
That's why I say, as a rule, you always play it right at the beginning. You get
let's play, because I didn't want to lose the doctor. Yeah.
Okay,
yeah. let's play it now. Let's go for a little quick break, and then we come back and we wrap it up, inshallah.
Okay, inshallah.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين.
Yeah, mashallah. Is that Brother Dawood?
Yeah, that was Brother Dawood. As part of our Eating Care work, is visiting hospital. So this was somebody who didn't want to be recorded, but this is, I just wanted to show you a glimpse of the work of Eating Care. When COVID goes away, we go and visit people who are terminally ill, people who are elderly in care homes and hospitals, and do different activities. So we have Eid parties, we have Quran recitation. We also have art classes, so that it's not all about pain. We do other visits. The Prophet ﷺ said, if you visit a sick person, you get 70,000 angels making dua for you from the morning to evening. Could you imagine that? You don't get 70,000 people even liking our show. But this is the benefits of. And this is the work of the model of Eating Care, and then you have the Muslim Burial Fund. So yeah, Jazakallah khair for that. I have a question. Shanaz says, "MashaAllah, beautiful recitation from Dawood." So she's watching as well. Alhamdulillah. I'm surprised she doesn't ask any questions today.
Yeah, now Jazakallah to all the brothers and sisters who do message and who are following 13 Rivers Eating Care. We're going to dedicate a show on Eating Care next week, inshallah. So get ready for that, inshallah. We want to dedicate a show. We want to go more in depth into the work of Eating Care next week. Today, we wanted to keep it a bit more general because of the COVID lockdown. So just before we finish, I know the sister might have to leave soon. We want to, obviously, the Tier 4 is going to have an effect. I want to just quickly go through what we can do and we can't do. Okay, so according to the new lockdown rules, these things include like residents should stay at home unless they have a reasonable excuse such as work or education. All non-essential shops must be closed. So I'm hoping that like loads of shops will be closed. So only essential shops, which probably is for food. All indoor entertainment must be closed. It's a shame because the gyms are going to be closed as well. No more 24-hour going to the gym. All indoor entertainment venues are going to be closed. You cannot meet people indoors unless you live with them or they are part of your support bubble. Okay, so just to kind of remind everyone. People should not leave their tiers. So if you're in Tier 4, you shouldn't leave the Tier 4 and go out somewhere else. You shouldn't be doing that. Yeah. Weddings and civil partnership and ceremonies are only allowed in exceptional cases, exceptional circumstances. I don't know what those exceptional circumstances are, but they're allowed. Yeah. So there are some basic rules. So Tier 4 is a bit more stricter than Tier 3. I hope people can kind of adhere to them. It is difficult. People are still confused. I'm going to find out if Abuwai is still confused or not. I'm just wondering.
Listen, are we allowed to go cycling again?
Yeah, well, you are. You're allowed to go. You're still supposed to do 1 hour exercise, and that's still part and parcel there.
Why is it 2 people at a time, or can we go as a group?
No, you can. So what happened? Well, you've been a bit cheeky here now. You've been very cheeky now.
No, sorry, right? Sister, I think I wanted to give Sister Samantha some time, and sorry, I'm just one question after another. But I think I love my walking now. I used to cycle during the summer and autumn time.
Shall I tell you what is happening here? Right, look, everyone's going for 1 hour. I've seen it, Victoria Park. Everyone goes for their 1 hour exercise, and guess what? There is walking rave, running rave, cycle rave taking place. You know,
Really?
everyone's meeting their friends. You know, like there, and it is legal because they're not interacting. They're 2 meters away. They're wearing masks. They're just doing the normal business. It's just conveniently they're all at the same place. Yeah. Okay. So if you go cycling, I'm sure you're going to bump into loads of people that you know. So these are some of the grey areas. There's no tying it up, but you're not allowed to meet people more than two, I think, more than one outside your bubble. Yeah. So if you're cycling and then you bump into me from a distance, you can say your salam. Maybe I'll follow you or you'll follow me.
Can I ask, if you don't mind, can I ask Sister Samantha a few questions?
Yeah, of course you can. Yeah, but no interrogation or anything like
No,
that.
no. Then you can summarize. Sister Samantha, earlier on we were just talking how you got to hear about Eating Care Muslim Burial Fund. Yeah. And you from there you decided to become a volunteer. I understand. Am I correct?
Yeah, you are. Yeah.
Yeah. So what happened? How did you get to hear about Eating Care Muslim Burial Fund?
So basically, about maybe 3 weeks ago, we buried a sister, our sister Lamia. May Allah have mercy on her. We buried her. And there was a lovely brother. There were a few brothers actually, but there was one tall brother in particular who kind of gave a little speech at, after she was buried. And basically, he actually showed us where some other Muslims were buried from Grenfell Tower. We needed to kind of raise funds. The organization was kind enough to bury the sister, but we needed to kind of donate, and he was talking about the work, and he was giving out some leaflets. He said to meet us by the car, and I got a leaflet. And from there, I just contacted the organization and asked if I was really impressed with the work, actually. I think it was the kindness, of kind of helping the sister's family in burying her. That kind of struck me because, we in this world we live in, and with COVID and people, the me situation, it's nice to kind of see people and Muslims, really being kind. So that attracted me to the organization, and I contacted them and sent an email and asked if I could be a volunteer, and that's how I came on board. I'm very new, so I'm hoping to kind of, benefit, provide my services, whatever I can do to help, really. And it really is, people say this, but for me it really is fi sabilillah. As I said, we buried our friend. In this dunya, we're here temporarily. The hereafter we need to think about as well. So for me, the more barakah I can gain, inshallah, the easier it is for me in the next life.
Amen, inshallah.
That was amazing, wasn't it? I told you, while you had technical issue, I
did, yeah.
Find out, and I was thinking that was amazing. Because you saw other brothers. I actually don't go to that many burials. I get too emotional and upset. But that one, when I heard about it, I actually went to that burial. And may Allah subhanahu wa ta'ala grant our sister Jannah. She didn't have a lot of family. Abdul Bhai, I'll pass it over to you now, inshallah.
Yeah, no, alhamdulillah. I mean, obviously we're actually at the end of the show. I've got to say, well done to everyone who kind of made comments and followed us. Key thing is people do continue sharing it. A lot of people watch our show as repeats. A lot of people are not able to watch it at the same time. So if you can kindly help sharing our link, Facebook links to your friends and colleagues, more people get to hear about that discussion. We will be always bringing topical discussions, debates, and informative work that we're doing, so that you are up to date with things, inshallah. And just to let everyone know, and I'll give you a quick reminder, what you can do in the Tier 4, okay, very easy activities that you can do. You can meet one or a meeting of one or other person from another household in an open public space if you both are alone. Yeah, okay. So that's what's allowed. It still doesn't ask the question about cycling. But anyway, I'm still going through. Shopping for essentials such as food and medicine is obvious. Outdoor pools, playgrounds, sport courts, golf courses, and horse riding centers can open. Yeah. You can leave home for work, education, training, childcare, and for medical appointments and emergencies. Communal religious places can still remain open, mashallah, so that's really good, but still social distancing, maintaining your mask, washing your hands, all those things have got to be in place as well. And also support bubbles are still allowed, and children can move between separate parents. Okay, so obviously there are different circumstances, so those things are still allowed. The gray areas are still gray areas. I ain't got a clue about the gray areas. I'm going to do my exercise. I can't stop that. I'm going to have to take my boy out for his exercise. And, if you do meet me in the park or you do meet me cycling, make sure you're 2 meters away from me and you're wearing a mask, okay? And don't sneeze on me. That's the most important thing, okay? And for everyone, you've got to maintain washing your hands. It is a serious thing. End of the day, you still got to live your life. And, so the best way you can do it is take precaution. And as a person of faith and belief, we've got to take our instructions from our faith, and all other communities, we're doing the same as well. So very quickly, before I conclude, Sister Samantha, would you like to just quickly, your last couple of words for everyone, and we can kind of conclude, inshallah.
Just to say to everyone, keep safe and really take this tier 4 business seriously. Just do what you can, and remember, you're keeping yourself safe and you're keeping others safe. And inshallah, God willing, we will overcome, inshallah.
Abu Wai?
Okay, 2 things, inshallah. I can see that Shanaz, who was a volunteer, still a loyal supporter. Moino is a volunteer. Both of them recently have lost, I think, their father, not to COVID, but and we should always make dua for all the people who have passed away, and we should do sadaqah jariyah, we should ask for forgiveness, and people who are going through difficulties, we should think about them and help them as much as we can. And my second point is we from 13 Rivers Trust, Eating Care, we're doing a Christmas Day. On that day, we're going to deliver food to over 150 people with cakes and lovely food. People would have been celebrating, meeting their families. We're looking for drivers. If anybody's interested, please contact us and we'll get you involved. Jazakallah khair.
Jazakallah, Abu Wai, thank you for being on the show. To all our brothers and sisters, Jazakallah for actually spending that time with us. Please do share. And also, there's some very good points Abu Wai has made as well. If you do want to give some time, alhamdulillah, we have a caring community, we have a loving community, and a lot of us have got very good heart, and we all want to help and contribute. We can only do that safely. And if you do want to take part with 13 Rivers, all our programs and activities, get in touch with us, get involved with us. Everyone's got skill sets that they can contribute and help with. At desperate times, more people helping, will bring more positive benefit to the community as well. And let's continue having the shows and discussions, inshallah. So next Wednesday, same time, 9 o'clock, inshallah, myself and maybe Abu Wai, or we may have another co-presenter with us, but definitely we'll bring different guests. We're going to be covering the work of Eating Care, inshallah. We need your help and support in getting the message out. On that particular note, stay safe, follow the rules, and stay healthy, do your exercise, call people, interact on social media, stay in touch with people, don't lose that human touch as well. And do your best, and I hope you have a safe holiday, whichever way you can actually spend it. More importantly, make sure that you are not the cause of actually affecting other people. Look after everyone. And inshallah, on that particular note, from myself and all the guests we've had and all the people who have commented, inshallah, assalamu alaikum wa rahmatullahi wa barakatuh.
hopefully before we die, we'll be up there in terms of impacting lives.
Inshallah.